Dear friends and colleagues, welcome to Science of Massage Institute. We'll discuss today how to use our video library, main educational source for medical massage. Our video library consists from three equally important parts. Let's review value of the library and see how each part of our educational project works. When you enroll in the video library, then you will have this landing page. And the first part of our video library is basic medical massage techniques. Without this part, it's impossible to succeed in clinical application of massage therapy, because this is foundation of entire clinical aspects. Our library of medical massage techniques unite all modalities and techniques developed by Western School of Massage Therapy in the clinical application. For example, you can see that we give you 10 effleurage techniques, 14 kneadings, and when you click on each technique, it gives you general characteristics, and then different types of the kneading in different parts of the body, for different size of the practitioner hand. By clicking on the links, it gives you video presentation of the different kneading techniques. For example, scrolling kneading. In one application, therapist can address and decompress superficial and deep skeletal muscles. This is very unique and powerful technique of kneading, which allows us to using lateral shift and decompress not only skeletal muscles, but all the fascia, which separate different layers of the skeletal muscles. Our library of massage techniques includes different variations, commonly used 7 basic massage techniques from the clinical perspective. That allows you to target soft tissue layer by layer and deliver stable clinical outcome when all other modalities fail. The second part of our video library dedicated to evaluation of the soft tissue. And you can see here the science of visual evaluation, science of clinical interview, and science of palpation, layer by layer, superficial, middle, and lower layer of the soft tissue. That information we're actually using during personal training in the patient evaluation with our students during medical massage certification program. The third part of our video library dedicated to clinical application of medical massage protocols. You have two options. On the left side of screen, you will see video library of medical massage protocols, and they arrange by the part of the body. On the right side, you will see slowly rotating Vitruvian man. These are two ways to find correct medical massage protocol matching your patient or your client needs. If you have already established diagnosis of pathological abnormality, let's say migraine, then you can go to the part of the body which is associated with that, which will be the head. If you scroll down, you will, among different protocols associated with the head, you will see migraine. When you click on the migraine, it will give you not only protocol of the treatment, but also clinical evaluation of the patient with the migraine to differentiate between different types of migraine. It can be cluster headache, occipital headache, temporal headache. Each of the specific type of headache has its own evaluation tools. And then after that, you have step-by-step application in the video format of all treatments, all techniques needed to decompress posterior neck, cervical spine, suboccipital space, and restore function and eliminate clinical picture. If you do not have medical diagnosis established by the physician, and you have only pattern of pain exhibited by your new patient or client, you can use Vitruvian man, and you can see that he rotates. Only what you need to do, you need to stop rotation by pointing on the part of the body which you concern. By clicking on this part of the body, it will give you different patterns of pain within the shoulder, and each pattern of pain accompanied by the medical massage protocol to address that abnormality. And you can see here that each pattern goes through the different part of the shoulder, and only what you need to do, you need to match your client complaints with the dark spot, and it gives you protocol associated with that pattern of pain. By clicking on the link, it brings you to medical massage protocol which fits pattern of pain exhibited by your client or patient. And as you can see here, besides the protocol itself, it also gives you evaluation of the patient with, in this case, deltoid muscle syndrome, starting from the questioning, from the different tests presented in the video format, and then eventually it will bring you to entire medical massage protocol, which will be arranged in step-by-step application. That allows you to fully decompress shoulder in this scenario and restore the function, because each step arranged in layer by layer basis. Each protocol will include evaluation of the soft tissue that you can differentiate which protocol need to be used. By having this access, you have chance not to wait for someone else as a guidance and use clinical picture and patient complaints as a tool to figure it out what abnormality you're dealing with and what needs to be done clinically using medical massage protocol provided by the video library. We have great success with our former students who now successfully practice medical massage around the country, helping patients when all other modalities of traditional and alternative medicine fail. One particular reason, they follow pattern of the development somatic abnormalities in the human body. Because only when we understand clearly domino principle of dysfunction, then we can restore the function and eliminate clinical picture when every other therapy fails. That's why video library is such a powerful clinical educational tool, which allows you not to follow someone else's recommendation, but build up your own clinical reasoning and the deliverance. We hope that you will join our medical massage certification program when we discuss all this information and helping therapists to address abnormalities developed in the body of the patient and save them from unnecessary surgeries or expensive therapies. I hope you will join us and we'll work together to bring you to the level of medical massage practitioner. Use our video library daily to help patients with pain nobody else able to address. It will give you priceless tools in achieving stable clinical results.